احنا دلوقتي في عصر ال CGM وظهر glycemic metric أهم من الهيموجلوبين A1C which is the time in range. والجايد لاينز كلها ال ADA والإسبات جايد لاينز بتقول مش كفاية الهيموجلوبين A1C يكون less than 7%، لا ده احنا لازم التايم in range يكون أكتر من 70% in the ratio أو in the range from 70 to 180، ولازم التايم below range يكون less than 4% between 54 and 69 and the time below range less than 54 يكون less than 1%، when the glycemic variability تكون 36% or less. لو احنا شفنا these two patients هنلاقي رامي and Sarah have similar hemoglobin A1C which is 7.1% and which is acceptable, but look to the glucose variability in Rami versus Sarah. Sarah has a very high glucose variability which predisposes to complications. So if we compare the hemoglobin A1C as the glycemic metric, which is still there, but the time in range offers more values. The hemoglobin A1C evaluates single hemoglobin A1C levels, but the time in range evaluates continuous glucose levels. The hemoglobin A1C compares the blood glucose or criticizes the glucose 3 months apart, but the time in range may compare fluctuations for any given amount of time. The hemoglobin A1C has limitations, is that it does not capture the hypoglycemia or the hypoglycemic levels occurring in the same day. That occurs with the time in range. And of course, the time in range is a bedside clinical tool that helps the health professional to give informed decision-making for adjustment of treatment. As you see here, these are the guidelines of the time in range, below range, and above range. Above range, it has to be less than 25%, 20% from 181 to 150, and less than 5% above 250. The glycemic variability is estimated by the coefficient of variation, which should be 36% or less. Why the glycemic variability has gained this importance؟ يعني ليه دلوقتي بقينا نركز على انه السكر ما يتذبذبش يفضل طالع نازل؟ Because glucose variability has been linked to the complications, to the morbidity and the mortality, and also it correlates to the hemoglobin A1C. Studies have found that 10% drop in the time in range was associated with increased frequency of less complications. So if the time in range is more, so the complications are less and vice versa. And of course, if we speak about type 1 diabetes, دايما بنقول ان the pillars of management is insulin, medical nutrition therapy, getting regular exercise, and monitoring blood glucose. Insulin طبعا هو دايما star of the management of type 1 diabetes, source of the fuel. It's an anabolic hormone. It leads to increased glucose uptake, leads to glycolysis, leads to ATP formation, and the deficiency of insulin will lead to a state of catabolism. And the ISPAT guidelines دايما بتقول لنا لو احنا ادينا الانسولين لازم نديه to mimic the physiologic secretion as much as possible. لو ركزنا على البيزل insulin, what is the criteria or what are the criteria of an ideal basal insulin؟ احنا محتاجين insulin that has high efficacy in a duration يكون more than 24 hours, so it leads to better control of blood glucose. عايزين safety, less hypoglycemia, فلازم يكون peakless أو with minimal peak أو flat time action. عايزين يكون متوفر فيه predictability إن ال variability from day to day or within the same day is less. ويا ريت كمان يكون فيه convenience and flexible dose timing, so better adherence occurs. دلوقتي الستاديز كانت زمان كلها معتمدة على الهيموجلوبين A1C و as a monitor of the incidence of the complications. دلوقتي بقت more and more the studies rely on the CGM and on the time in range. وخليني أعرض لحضراتكم the in range trial, which is a head-to-head randomized control trial comparing insulin degludec 100 with insulin glargine 300 units per ml. This is the study design, multi-center, randomized, active controlled, parallel group. It was done in adults with type 1 diabetes, and this is the study design. The primary endpoint was يا ترى البرسنتج of time in range في مين أحسن. المين secondary endpoints الجلوكوز variability والchange in the hemoglobin A1C والsafety as regards the hypoglycemia. مقارنة الدجلوداج 100 بالجلارجين 300 بالنسبة للprimary endpoint, it was found that the glargine 300 was non-inferior to the degludec 100. يعني ما فيش فرق بين الاثنين. في المين secondary endpoint برضو ما فيش فرق في الجلوكوز variability بين الاثنين أو coefficient of variance. يمكن كان السوبريوريتي of time in range باينه في الجلارجين 300 بالنسبه للديفرنس في التايم above range. results showed clinically relevant improvements in the hemoglobin A1C. بالنسبه للهايبوغلايسيميا ما كانش برضو في فرق بين الاثنين as regards the hypoglycemia. Let me introduce to you another study that studies the effectiveness and safety of insulin glargine in comparison with insulin degludec, evaluated with continuous glucose monitoring برضه في الادلتس in type 1 diabetes. وطبعا دايما زي ما حضراتكم شايفين الاستاديز بتبدا الاول في الادلتس وبعدين بتتجه للاطفال، وبرضو حاولت ان هي تعمل randomization وتقارن two arms, arm glargine 300 with the other arm insulin degludec، ولقت ان في non inferiority بالنسبه لل different periods في ال 24 hours when the number of episodes of hypoglycemia and hyperglycemia were not different. So the take home message is that new metrics such as the time in range and the percentage coefficient of variance have emerged from the development of CGM technology. The in range is the first randomized control trial in adults with type 1 diabetes designed to compare the glargine 300 with the insulin degludec 100 with the primary endpoint assessed through the time in range. In range study لقت ان في non-inferiority as regards comparison of both types of insulin as regards the glycemic control and the glycemic variability, and also the real world evidence study, which is OneCare, provided confirmation and consistent results with the randomized controlled study time in range. So thank you very much. في QR code محطوط. QR code. Yes, please.